meeting the MP, our regional minister for Northern Region and also some of the DCs. We just want to say thank you again. Why we came here today because one, the main reason we came here is to see the staffing issues. First, we have posted some doctors to the Northern Region, and not all of them showed up. So our main goal today is to find out how many of them have shown up today, and those who haven't shown up, the question is why, and what we will do with those who didn't show up. Because the goal for the government or for the ministry is to make sure that at least every district has 2 doctors. And so the reasons why they are not showing up, we should be very interested so that we can talk to the regional minister, the MCs, and also some of the hospitals to see how best we can support them. But while we're at it, we also see that most of the CHIPS compounds that we've been, the health centers that we've been, the polyclinics that we've been, we do a lot of deliveries there. And whilst we are there, we have also seen that our maternal mortality rate is going up. And so while I was looking at the staffing and the doctors, the issue became, while I'm here, what are some of the needs assessment of the midwives? What are the needs assessment of the hospitals? What are the needs assessment of the CHIPS compound? What are the needs assessment of the polyclinics and the health centers? As you all know, the government has looked at Ghana Health in its entirety. And for me, I look at it as some sort of a pyramid or a 4-square box. Inside the box, we are looking at the very bottom of our health system, and that is the CHIPS compound, the health center, the polyclinic. We are launching next month a program called the Free Primary Healthcare. The free primary healthcare is that every Ghanaian who comes to a CHIPS compound, goes to a polyclinic, goes to a health center, will access the health for free, so the health delivery for free. Now, once we do that, we will also include preventative and promotive, because that is where we see that we're not, people are getting lost in the system, that we're not doing a lot of prevention and promotion. So once we do that, we're doing that for children, but not really for adults. So once we are able to identify the people and prevent the diseases, then we won't wait for them to get sick before we take care of them. Currently, our health system is mainly what we call curative. So we wait for people to get ill, and then they come to the hospital and we treat. But we have also noticed that if we put in prevention and promotion, the people will not get sick as much in the first place to show up at the hospital. So it's a little bit of shift from how we do business as usual. So we are going to focus on preventative. That means that the community health nurse will also be very involved. So they're looking inside the community and seeing the people that are high risk and see how best. They are also doing disease surveillance. We are looking at what is happening in the community. Then we have also noticed that there's a lot of people with diabetes and high blood pressure. And that has led to that 43% of all mortalities in Ghana is because of non-communicable diseases. So when we look at non-communicable, we are looking at high blood pressure and diabetes. That's number 1 and number 2. Of course, we have cancers, and we have the genetic diseases. But the main one is diabetes and hypertension, which is high blood pressure. So if we can see them at the lower level, then we can prevent them from getting to where they're going to have the complications. But at the same time, we've also noticed that some people already have it, and they already have complications. And they already have the kidney disease, they already have the heart disease, they already have the coronary artery diseases, and all other diseases that leads from the uncontrolled or not properly treated diabetes and hypertension. So we have instituted the Ghana Medical Trust Fund, which we call Mahama Cares. So Mahama Cares is also to look at the people. So I'm looking at them at the top and the free primary health care at the bottom. And in between is our national health. So at the very top, The people are having the kidney failure, they need dialysis. Some of them can't find dialysis. They have to bring them from the north to Ashanti region or go to Accra. So Mahama Care is looking at all those. So we are going to provide them the equipment they need. Not only the equipment they need, but they also need the specialists. You know, the heart specialists, the diabetic specialists, those specialists. We need them to take care of them. Then we are also doing research. So Mahama Care, as you have all seen, is on the news. You see them, they are giving patients checks, because most of the time, by the time they get diabetes and they get to that stage, it's usually some retired person who can afford even the disease that they have. So they are on TV soliciting for money, they are on radio asking for help. So that is the fund that will give them to support them. But after the fund, we still need to fill in the gaps of the care. That's why in Tamale Teaching Hospital, we are doing something called the Cardiac Center. A cardiac center is one of the specialist care that the people at the top who have the diabetes and the high blood pressure who have complications, they will need. So Mahama Care is going to plug in on that. We're going to do dialysis and make sure that at least every region has dialysis there, and we don't have to send the people to other regions to do dialysis. So we have done the needs assessment already, and we are plugging in the holes. And then we need to also help our health staff, you know, training, to upgrade their training. That's why the director for the nursing school is here, to upgrade their training, the nurses, the doctors, the allied health people, so that when these advanced equipments come, when we have a cardiac catheterization lab or we have a cardiac center, we have the proper staff to staff it. So it's one of those things. That's just Mahama Care. So with Mahama Care's free primary health care, then in the middle is our national health insurance, NHIS. As you can tell, we uncapped it and we got about 3-point-something billion cedis additional that we have pumped back into the system. And not only that, now all of our vendors have been paid. And if you bring your claim within the same month, all your claims will be paid. So we are really working diligently because health is very, very important to President Mahama. I think one of his main goals is to make sure that Ghanaians are healthy. And he's committed, as you heard him in the State of the Nation address, how many hospitals he's going to build. We are going to retool all of our hospitals. When I say retooling, that means we are going to buy equipment. Today we went to the CHIPS company and they were talking about delivery beds. Those are some of the things I'm talking about retooling. So we'll make sure, and the delivery sets, we'll retool the hospitals, the CHIPS compound, the health centers, as well as the polyclinics, so that our referrals will be less. And when the referrals are less, it takes the pressure off the big hospitals, because some of the things we can do, but we are only referring because maybe we don't have the equipment. So if we can take care of it at the basic level, then we don't need to refer and put all that pressure on our regional hospitals as well as our teaching hospitals.
How many doctors were posted to the and how many?
Thank you. In fact, I don't have all the numbers, but I know overall it's about 700 doctors across the country. I know that in the northern region today, we looked at it, it was about 25, I think. It was 32 total, but 8 were going to the child hospitals. So the Ghana Health Service hospitals was like 25. And I think most of them have shown up, most of them 18. Yeah, I think it was more than that, because today we heard that it's 25 and 18 have reported. The ones who haven't reported, I think that we have said enough, and so our goal is to maybe replace them and find other ways, because some of them said they are not coming and other issues. But we are here to appeal to the regional minister, to the MCs, that they should support us to support these doctors, because our goal is that at least every district hospital should have at least 2 doctors. When you go to your hometown and it's in the village, maybe my hometown is in the village, I want to make sure that there's a doctor there that will take care of me. So we came to see those who have shown up to work and thank them for the good work they have done. We know it's not easy, and so we are working on how best we can help them to support them so they can stay. I saw the young lady here, she said she's a volunteer. Actually, she's finished medical school and she's going to start a housemanship, but she's already volunteering to work. Somebody like that, if she finishes and she wants to stay here, we can support not here to stay, because we want people who are committed, who will come and help us, so that each one of us here, someday, if we become patients, we'll have good health care where we come from, in the district where we come from, and not everything has to be a referral. So far, the 18th at Action, I want to say thank you. Those who didn't show up, I don't know what else to say, but we'll continue to add. So that was the first batch. We have a second batch that is coming, and also the goal is that every district treasuries have 2 doctors that are there to support the district.
Honorable, you mentioned retooling. How soon do we expect that?
Oh, the retooling will come very soon, not even after we launch, or even sometimes, I think we'll do some before we launch, the week before we launch the free primary healthcare, which is next month, is when we're, I don't know the exact date, but it is in April of 2026. We'll launch the free primary healthcare. But even before that, we'll start sending out some of the equipment that the people need. So we've done very good, thorough assessment of the entire country and our health needs. You all heard about the no bed syndrome, all those issues. You know that the no bed syndrome is not necessarily the actual bed, but it is the staff and everything that goes, because even if you have a bed and you don't have a proper doctor to take care of you, you come and lay on the bed and he won't help you. So it's a systemic thing. So we are trying to solve the problem systemically, from the ambulance side to the bed, to the tools, to the right staff, to everything. So we are on course. We ask that you continue to support us, continue to support President John Mahama for his good works. For me, as a physician, and this is like the best time for health, Ghana's health, that I have seen. And also I'm in a situation where I get to see some of the things that we are about to do, or we have already started. Mahama Cares has started, the bill is passed, it's on its way. Free primary health care, everything is done. We are working on a special purpose vehicle to take care of the equipment, because you know our maintenance issues is a problem. Because President John Mahama retooled the hospital, I think in 2016, 15, 16. As of this time, almost all those equipment are broken down. So we need to do something different. We can't continue doing the same thing over and over again and expecting a different result. So we are thinking outside the box a little bit, and we are seeing what different thing we can do for equipment maintenance in our hospitals, so that the retooling that we do today, 4 years from now, all the equipment will not be broken down. They are still working, and they have been well maintained and well calibrated. The warranties are still working, and the service agreements are really working, so that we just add on, and not every time doing it again and again and again, and every day we're in the same situation. So thank you again for all of you for being here.
You talked of women dying every 2 weeks in the northern region. Do we know the figures for last year? What is accounting?
I think the regional director will talk about it, but the reason why I'm talking about that is that I've been taxed with the maternal mortality issues in the country. As you can tell, the index is going up. So the Honorable Minister, Honorable Akandoh, has tasked me with making sure that we reduce those numbers, because those numbers are kind of alarming. So my goal, I think, is a little bit overly ambitious, but I like to be overly ambitious first, and then, because if I don't set high goals for myself, I don't want to. So my goal is to reduce it. I think last year it was 955 per 100,000 life births or something like that. The WHO criteria is 70. And according to district director, regional director, sorry, you have two. So the numbers are not favorable, but this year, my goal.
At the policy level, what policy measures are you taking in place?
At the policy level, the reason why is that we are now working on the, as I have been tasked with it, that is why I'm doing this needs assessment and going around and putting the maternal thing inside. Because we need to work with data, and we need to work with proper evidence. So we'll go around the country and do proper data collection and proper evidence, then we'll make policy suggestions, go to the right places, and hopefully by the end of this year, we can at least, if nothing at all, we can reduce those numbers.
So we want which one? The devs.
Martina asked the question again.
No. So that's what we're saying, that if you look at the figures that we have, the target is looking at 125 per 100,000 lives. What it means is that for all delivery, the lives back, if you take 100,000, you are going to record 125. That's what it is. And if you are looking at it in terms of counts, that for 2025 we recorded 106. If you are looking at it in terms of numbers per every week, it means that within every week for 2025, 2 mothers lost their lives in the Northern, and we think that it is huge. It is a collective responsibility of all of us, including the media. What do we need to do to be able to strengthen the peripheries, that the pregnant women get the best of care at those levels? We are currently at a district level. What can be done to prevent deaths at that level? Or what can be done to ensure that the mothers have safe delivery at the CHIPS health center or the primary hospital level, so that we reduce the referrals that go to the regional hospital or the city hospital? That's why I'm calling on everybody to be able to support us, to be able to help reduce these numbers within the
Thank you. Thank you, Nora.
We are going to have to take this time is fast spent. This is Director, Medical